Hi, so now let's talk about viral diseases of the digestive system. Focus is going to be on mumps and hepatitis. So mumps is included in the digestive system diseases because it is a disease that commits the parotid salivary gland. So the saliva and the respiratory secretions are going to be the path of transmission. The virus, the mumps virus, multiplies in the respiratory tract and reaches the salivary glands via the bloodstream. May cause orchitis, meningitis, overinflammation, and pancreatitis. So these are considered complications. Orchitis is swelling of the testes, okay? And it can be prevented with MMR. You have 78% of efficiency with the first dose and 88% of efficiency with the second dose of the vaccine. Symptoms, when you look at the patient with mumps, you see this swelling of the side of the cheek, and that's where the parotid salivary gland is located. So we have salivary, submandibular, and sublingual salivary glands. The parotid one, which is right behind your ear, kind of under the ear, is the one that is infected by this virus. So symptoms in this disease include headache, muscle aches, tiredness, loss of appetite, and these symptoms usually appear 16 to 18 days after the infection. But it can change from 12 to 25 days after infection. Most people with mumps recover within 2 weeks. So now we're going to talk about hepatitis. Hepatitis is inflammation of the liver. Hepatitis can happen due to other factors, other causes that are not microbes. It can be a result of chemical toxicity. For example, alcoholic people usually can have a situation where it inflames the liver. Epstein-Barr virus, cytomegalovirus, or the hepatitis virus. So this is the one we're going to focus on, the hepatitis virus. There are 5 different types of hepatitis viruses, okay? So we have A, B, C, D, and E, and you see that A is very similar to E in the sense that it can be acquired by ingestion. Symptoms usually are related, are shown as fever, headache, malaise, jaundice in severe cases, and there's no chronic disease for A or E, okay? In the E, you also have pregnant women with high mortality. And then you have B, which is sexual contact, and C, which is parenteral, D, which is parenteral, okay? And it requires co-infection with B. So D only happens if you already had B. And B can also be parenteral. I forgot to mention that. There are vaccinations for A, inactivated virus, B, genetically modified virus, and the gene of the virus is produced in yeast. And D, no vaccine for C or E, okay? I have another diagram that may show you a little more detail about these different types. I just want to mention that the number of cases in the United States in 2018 was higher for hepatitis A, around 12,000 cases per year. And second came hepatitis B with C with 4,000 cases, and B with 3,000 cases. So other things that we want to mention here about these types. I like this slide because it's colored, so you can look at different features of the disease too. Yeah, one thing to here again, A and E. Sorry, A and E are similar, and E also has risk for pregnant women and risk of cirrhosis. B, also risk of cirrhosis and liver cancer. C is either asymptomatic or flu-like symptoms in most of the cases, but is parenteral. And B is the sexual one. B can cause chronic disease, okay? So I have a slide here that shows you also a little more detail about B. The chronic disease involves 10% of infected patients in the case of the hepatitis B, and may lead to liver cirrhosis. So this is the one that could be become chronic and be more. There is no cure for chronic hepatitis B, so the best way to protect yourself is by not sharing syringes with anybody and being vaccinated, okay? So there is only one fungal disease, so I'm just going to go ahead and talk about it here that we are going to focus on, which is aflatoxin poisoning. Aflatoxin is produced by Aspergillus flavus, which is a fungus. Usually you find this in peanuts, but it can also be present in maize. Okay, so crops, due to inadequate harvesting and storage technique, can accumulate this fungus that produces this toxin, which is what we call a mycotoxin, right? So aflatoxin is a carcinogen and mutagen. So it's going to cause liver disease. It's going to cause liver failure and death in up to 40% of the cases. There was an outbreak of aflatoxin poisoning in Kenya in 2006. And usually what happens is that aflatoxin has a mechanism that interferes with metabolites in various cell proteins, and that causes disruption of metabolic pathways and protein synthesis, causing death of the cells. Okay? They're also toxic to DNA. So it's what we call genotoxic. So that's how it can cause carcinogen. Okay, it can cause cancer or mutate the cells and cause other conditions. We have some protozoal diseases that we're going, which are Giardia or Giardiasis, the name of the disease, and then amoebic dysentery. So Giardiasis is caused by Giardia intestinalis. That's the name of the protozoan. Look at the little flagella here, you see? And it is transmitted by fecal-oral contamination. This protozoa is present in the form of cysts in feces and water and inside the body as trophozoites. Okay? You usually can get contaminated with this by drinking water, for example, from creeks and lakes that were, the water was not filtered. If you're in the mountains, you're gonna have that type of situation. Prolonged diarrhea, malaise, weight loss, flatulence, and cramps are also a way to have this disease. Diagnosed with microscopic examination of stool samples, that's how you detect, because it's easy to see the protozoan under a microscope, right? And symptoms of this disease are usually very loose stools with increasing fatigue, because the bacteria starts to eat parts of the intestinal wall and make you weaker and they also eat blood. In cases more severe, you can have itchy skin, hives, and swelling of the eyes and joints. Okay, it can also cause this more profound weight loss and keep the body from absorbing nutrients because you're damaging the intestinal wall. And it is related with lack of vitamin A and B12. These are some deficiencies that are going to be deficiencies that are going to be a consequence of this disease. Okay. Some people have Giardia and have no symptoms, so that is possible. The symptoms usually end after 6 weeks, between 2 and 6 weeks. There is possibility in kids of having retarded growth and physical and mental development slow because of the infection if it's not treated. Okay. Amoebic dysentery is caused by Entamoeba histolytica. So this protozoan is one of those that eat red blood cell. The trophozoites produced from cysts in the intestines are super important in making the person sick, right? The feces contain blood and mucus. That's why it's called dysentery. Remember, we mentioned this before. And it causes perforation of the intestinal wall, formation of abscesses. There is a very typical, they eat red blood cell, right? They can invade the liver. And there is a very typical lesion here. See, it's called flask-shaped ulcer, which is this is the ulcer here. See, this is the intestinal wall here, and then suddenly you see this looks like a volcano, this type of ulcer. Also, 10 to 20% of people that get infected with Entamoeba histolytica become sick, okay? It can be difficult to diagnose because it can be similar to other parasites under the microscope, other amoebas, okay? Okay guys, next video I'm going to talk about helminthic diseases. I'll see you soon.